Hello everyone, welcome back to the channel. In today's video, we're going to learn one of the most important topics in ICD10CM, conventions. So, what are ICD10CM conventions? Conventions are the rules and instructions used throughout the ICD10CM book to help coders assign the correct diagnosis codes. Following these conventions to ensure coding is accurate and consistent. So, let's get started. Excludes one note and excludes one note means not coded here. It tells the coder that the two conditions cannot be coded together because they cannot exist in the same patient at the same time. They are totally opposite to each other. Few examples from the book are congenital cataract versus age-related cataract. Person born with a cataract has a congenital cataract, or a patient who develops a cataract later in life has an age-related cataract. Since one condition is present from birth and the other develops with aging, they are mutually exclusive. Therefore, they are not coded together. This instruction you can get with category code as exclude one condition. Another example is type 1, diabetes mellitus versus type 2 diabetes mellitus. Type 1 diabetes is generally seen in children because the pancreas produces little or no insulin. Type 2 diabetes develops later in life due to insulin resistance. These are different types of diabetes, and an excludes one note indicates they should not be coded together. Remember, excludes one means choose the correct diagnosis, not both. 2. Excludes 2. Note, an excludes 2 note means not included here, but sometimes both conditions may exist together. If a patient has both conditions at same time, two codes can be assigned. Example is COPD with acute bronchitis. A patient has chronic obstructive pulmonary disease, COPD, and also develops acute bronchitis. COPD is a long-term lung disease, while acute bronchitis is a short-term infection of the airways. Since both conditions can occur at the same time, ICD10CM allows both codes to be reported when documented. Another example is irritant diaper dermatitis and candidal diaper rash. An infant may first develop irritant diaper dermatitis due to prolonged contact with urine or stool. Because the skin becomes damaged, Candida, a yeast infection, can grow in the affected area, causing candidal diaper rash. In this situation, the child has both conditions at the same time. Therefore, under an excludes 2 note, both diagnoses may be coded if the provider documents both conditions. Next instruction is use additional code. Sometimes one diagnosis code does not tell the complete story. In these cases, ICD10CM instructs us to use additional code to provide more details about the patient's condition. For example, I1, 2.9, hypertensive chronic kidney disease, and N1, 8.3. Stage 3, chronic kidney disease patient here has hypertension and kidney damage, but stage needs to be specified, so we need extra codes to specify stage of chronic kidney disease from N1 8 category. Another example is gestational diabetes mellitus with insulin use. A pregnant woman is diagnosed with gestational diabetes mellitus. The main diagnosis is coded from category 024.4-. If the medical record states that the patient is using insulin, ICD10CM instructs us to add code Z79.4 long-term/current use of insulin. This additional code provides important information about the patient's treatment. Next is use of words and /with in a code. When two conditions are linked by the word with and in the alphabetic index or tabular list, the coder should assume they are related unless the provider clearly documents that they are not related. Example is Crohn's disease. Look at category K50. Crohn's disease can affect small intestine, large intestine, or both. If the patient has Crohn's disease of both the small intestine and large intestine, instead of assigning separate codes for two parts, you select the combination code from category K50. Next example is E11.319. This code means type 2 diabetes mellitus with diabetic retinopathy. The word with tells us that the eye condition is a complication of diabetes. So instead of coding diabetes and retinopathy separately, ICD10CM provides a combination code that links both conditions together when appropriate. Now let's learn about the seventh character. The seventh character gives extra information about the condition. This is alphabet or a number added to code, in code, S52.501A. The last letter A is the seventh character. This shows patient is receiving active treatment for the injury. Another example is glaucoma code H40.11 here. Last character 1, 2, 3, 4 shows the stage of the disease, which can be mild, moderate, or severe stage of glaucoma. Next is placeholder, that is alphabet X. Now let's understand it. The letter X is used when a code needs a seventh character, but there are not enough characters before it. The X acts like an empty space holder. It has no medical meaning. Its job is simply to keep the seventh character in the correct position. Example is T16.2 X, X, A. Notice there are two XS before the letter A. Those XS are placeholders just to make sure that A stays in the seventh position. Second example is T36.0X1A. Here the X is again used as a placeholder. If you found this video helpful, don't forget to like, share, and subscribe for more easy medical coding lessons. Thanks for watching, and I'll see you in the next video.